Hi, this is Dr. Jessica Hochman. Today we're going to discuss childhood stuttering. If you are concerned that your child stutters, I promise you, you are not alone. As a general pediatrician, it is one of the more common questions that I get from parents as their children are learning to speak. Stuttering, which is also referred to as speech disfluency, is a very common part of childhood. We often see it between the ages of 2 and 5 years old. About 3/4 of the time, speech disfluency will recover on its own without any intervention. When children are learning how to talk, it is very common for their speech not to sound smooth at first. It may sound repetitive. It may be hard for them to get their correct words out. And this is very common for many skills that we have in life. It takes time for skills to become automatic. So similarly, when we're learning how to drive a car, it takes us thought at first. We have to remember to put our key in the ignition, to look over our shoulder, to turn the steering wheel, to step on the gas. It's not as automatic initially. And it's very similar with speech. When we learn the syntax and the order of words, it takes kids time. Another consideration for why children may repeat words at a young age is that they have much faster thoughts than their ability to speak yet. So by repeating words, it actually can buy them some time until the words come to mind. If we notice stuttering, what should we do about it? The answer is, at first, absolutely nothing. It's important to give it some time and to not draw attention to it. After all, we don't want to make our children self-conscious, and the odds are this will get better over time. Listen with all ears. Make sure that if your child is trying to talk to you, that you give them your 100% undivided attention. For example, many children will say, "Mommy, mommy, 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 mommy," over and over again, and the best thing we can do is stop what we're doing, look at them, make eye contact, and give them our complete attention. Be a good speech role model for your child. Make sure to speak clearly, slowly, and in an unhurried way. Give your child time and space to talk. Listen with patience. Although you may be tempted to say, "Slow down," or "Take a deep breath before talking," don't do this because it will add unnecessary pressure. Now, what are some signs that your child may benefit from a speech pathologist? Now, this may be tricky because remember that about 75% of kids do recover on their own without any intervention. For one, if you notice signs of stuttering and there is a family history, about 60% of adult stutterers do have a history in their family of stuttering. Two, if you've observed your child for 6 months to a year and you don't notice any signs of improvement. If you notice what are called blocks or pressured speech, especially at the beginning of a word, as if it's hard for someone to move air. For example, mommy. Are there any motor behaviors that go along with the speech? So for example, blinking their eyes or making a facial grimace. And lastly, if you notice your child avoiding talking or social activities for fear of speaking. Speech therapy can be incredibly helpful for children that stutter. If you have any questions or concerns about it, make sure to reach out to your pediatrician or to a speech pathologist. I'm going to put information for the Stuttering Foundation below. Thank you for tuning in to this week's episode of Ask Dr. Jessica.